this whole book review thing, chapter by chapter, has been kind of exhausting, and I just kind of had to take a break. And also, Halloween was on Saturday, and I had no time to record anyway, so that's my excuse. I hope nobody was like super like with bated breath, like, oh my god, I need to see the next one. I need to see it. You could just buy the book if you're like that. Don't count on me. Anyway, so this is Irreversible Damage, Chapter 9. We're almost done. Very, very close. This one's subtitled The Transformation. This one is all about the physical transformation itself, the surgeries. She doesn't cover she doesn't really cover the ones that are less risky, and it makes sense because, they're less risky. So Abigail outlines, she first talks about skeletons and how they're very sexed, and men and women stand and walk differently because of the way that our hips and femurs or whatever are like women's are like kind of like this because their hips are wider, and then men are more parallel because their hips are narrower. And there's other parts of the skeleton, like a man's skeleton is slightly larger than a woman's on average, and something about behind the ear, I don't remember, the bone sticks out a little bit more, and the forehead like goes out like a Neanderthal, kind of thing, kind of sticks out a little bit more, and there's other details to it too. I believe her point is because our skeletons are sexed, therefore it's not it's not, for lack of a better phrasing, it's just not easy to go from one sex to the other, because you will always have this skeleton as a man, a biological man. You're always going to have this masculine skeleton no matter what you do, no matter how much makeup you slather on yourself, no matter how long you grow out your hair. No amount of surgery is going to ever fix that. Like facial feminization surgery is not going to fix that. Like it might kind of be suggestive of feminine, but it's still, you can just still tell that that's a man's face. And she says, quote, "Gender transformation is an uphill battle," and I completely agree with that, because you are fighting your biology, and your biology is pretty unrelenting. And being trans, you're always, depending on, I guess, what type you are, you're always battling against your body. There's nothing you can really do about it. And that's one of the reasons why I stopped, because the battling was it was unrelenting. It would not stop. And no matter how comfortable I would get, there would still be like this whole like, oh, well, I'm still in a female body. Surgeries are complicated. Cross-sex hormones are risky for long-term use. Infertility is a strong possibility, depending on which way you go down. And puberty blockers are a definite send to sterility. And she starts off with talking more about Lupron, and I already kind of covered it. And one of the things that are new to me was that it is a chemical castrator, which, based off what I read from her link, it didn't really seem like it's a permanent thing, which when I think of castration, I think, snip, snip, you're done for good, buddy. One of the things that was kind of interesting to me, and I didn't even think about this before, is, especially depending on what age that kid starts to be on Lupron, which is most likely going to be around 8 to 13 years old, but like the younger they're going to be, the more stunted and small they're going to turn out. And then a lot of the times these kids will be on it for years. They shouldn't be on it for more than 6 months, but they're on it for years, and they could be on it until they're 15 years old sometimes. And she says, quote, unlike all of her friends, she has no pubic hair, she's never had a period, she has no breasts, she's never experienced orgasm. And then another quote, to proceed through high school with dwarfism. I think that's a hyperbole, to be honest. I think we know what dwarfism really looks like. When you're just a shorter kid, that's not dwarfism, obviously. So it's probably a joke. Remaining the size of a much younger girl, and yet the change in height brought on by growth hormones is arguably far less profound than that caused by puberty's year-long flood of hormones, which which transform our bodies into sexual adults. End quote for that one. The next quote is, even if those peers are perfectly sensitive and supportive, surely the girl on blockers will be acutely aware of her strangeness. Other girls her age have breasts, hair under their arms, struggle to manage their periods, say things that indicate sexual awakening, all things she knows little about. She is likely to feel more alienated from womanhood, not less, after she's been cut from the team endocrinol... Oh, oh Jesus. Endocrinology, speaking that. I do think this is a good point. However, when this little girl is going to be set on being, trans, they're going to be set on being a trans man, they're not going to be thinking about, oh, I don't have breasts like my girlfriends do. I don't struggle to maintain my periods. You know, womanly things, if you will. Like, they're not going to care about that. They're going to be going into it like, I don't really want to be a woman, so I'm not going to care about that. They're probably going to be celebrating a little bit because, like, hooray, I don't have to experience what they have to experience. So I was thinking this would more apply to when the girl is trying to relate to other guys, because she may or may not want to go into the pack of boys around her and, be friendly with them. Even though I know a lot of these young trans people mostly stick around with girls. Kind of ironic, but some of them will go in a pack of boys. And what'll happen is she won't grow the pubic hair. She won't grow a penis. She's not going to understand when they start talking about sexual things, like, oh, that cute girl, Cindy, oh gosh, she's so hot, like, these boys they're going to inevitably talk about these things, and even if they are perfectly sensitive, as Abigail says, and they're supportive and stuff, they're still gonna do what boys are gonna do, and the whole being on puberty blockers until like 15 or something, she's still gonna be alienated no matter what. Moving on to cross-sex hormones, she talks about testosterone, and I heard somebody, I don't remember who, but I heard somebody saying on the detrans subreddit saying that testosterone is a very mild antidepressant, and I would also say it's also a anti-anxiety sort of thing, and like, in a way it is these things, and that's what made me feel so good while I was on it, and that's one of the things that I actually missed about getting off of testosterone, because I was disconnected from depressive thoughts. And it's like, yes, men can be depressed, duh. They can also be anxious, yes, of course, but it hits deeper somehow when it comes to women with estrogen and stuff. So when a depressed woman gets on testosterone, she has this illusion of everything's really substantially better for her in life, and it's very seductive, and it does make you want to stay on testosterone because you feel so much better. Abigail points out that these trans-identified teens, quote, call their distress gender dysphoria, but what they may be treating is anxiety and depression. And I just think that's such a good point. That's really largely what it is, I think. Because nobody wants to be depressed, and sometimes, like myself included, I didn't want to go on antidepressants because I didn't want something synthetic and possibly addictive or would like ruin natural parts of me, I guess. I didn't want that effect to happen to me. And I didn't want to be dependent on something, which is ironic because I would have to be dependent on testosterone for, hypothetically, the rest of my life. But it felt natural enough to me where it just felt natural enough to me, and that's really it. Testosterone made me more bold, courageous, outspoken, and unafraid to do stupid things, which is one of the nice things when you're more anxious. Like, I was still anxious, yes, but like I felt more. I guess I felt more like I was taking up space in a way, and it kind of felt empowering. At least with my friends, I would be more fearless. That's kind of what it gave me. Pre-testosterone, I shied away from boys, and I shied away from boys. Post-testosterone, I was unafraid. I was louder. I was numb to my emotions, and I remember horror didn't really bother me that much. The horror genre, like video games and movies, they didn't bother me that much, and I was very willing to watch it. Like, I had watched The Thing. I don't remember the director's name, but I watched The Thing with my friends, and it didn't really faze me that much, even though it was very grotesque and the effects were they were practical and they were very disgusting and disturbing. And then now when I look back on The Thing, I'm like, oh God, I can't watch. It's so, gross and, oh geez. And I was physically stronger, and because I was physically stronger, I felt more self-sufficient, which was something I deeply cared about. Self-sufficient was independence, and I liked the independence that testosterone sort of gave me. And of course, with like some of your problems being lifted, of course, like a young girl would be like, woohoo! Although I wouldn't really understand if you're on puberty blockers or I guess there might be a case where they just get on testosterone immediately and skip out on the whole testosterone thing. But anyway, they wouldn't really know because there's no comparison. Because when you're a female and you've gone through female puberty for the most part, and then you go on testosterone and you're like, woohoo, no more periods, no more fluctuating of my emotions, no more mood swings. Of course you're going to be like, hooray, woohoo! Abigail points out that one of the things that are kind of risky about it is that it, quote, lessens short-term memory and increases moodiness and irritability. And I do remember being more irritable, especially toward my mom, and a little bit less, but also toward one of my older brothers. I do remember being irritable as well as rude to school staff and my female friends. I was probably rude to my male friends too, but they're male and they don't give a shit. They don't care as much, or at least they don't show that they care. So another seductive thing about testosterone is that it gives you a sense of disguise, as she says in the book. These aren't my words. It's a sense of disguise, a new identity. It does feel like a rebirth. I mean, that's what it basically is. I mean, there's one part of you that's the female part in this case, and that comes with its own assumptions and stuff, and then being the opposite sex is kind of a different person, and no longer do the the social female stuff apply to you anymore, although you most likely will get the gay stuff applied to you, the gay man stuff, and that's not exactly easy. But But what she says, what Abigail says is, no longer do the norms of female body shaming apply to her because no one judges a male body, I guess. But, like, I do agree, of course, that, you know, girls get it really bad if women get it very bad on their appearance, and a bunch of horrible people, men and women alike, will be like, ooh, it's scrutinizing the hell out of her. And, but I do kind of want to argue a little bit that men get it as well. Like, men will get scrutinized for, you know, their facial symmetry, their, you know, their style. Like, if you look really bad, you know, if your hair is greasy, you know, stuff like, generally just not taking care of yourself. If, you know, you packed on more than a few pounds, sort of thing, like, people are still going to be like, this person's horrible, let's bully this guy. Like, they're still going to do that. It just doesn't, but it's just not the same thing as young girls and women getting scrutinized by the public and possibly family and stuff. And men do have the one up where if they're just incredibly talented, um, have a bunch of money, stuff like that, they'll kind of be protected by that. But as soon as people have dirt on that guy, uh, the bullying is fucking relentless. It's horrible. You know, welcome to cancel culture. Here we are, you know. But the point of why I'm pointing that out is because, like, when a young woman is looking at, like, oh, men don't get these things, only women do. It's like, no. Men get it just as much, and men aren't allowed to complain about it, because otherwise they just look like a wussy, you know? A sissy boy, and that's gonna, you know, encourage more bullying from other people. So it's like, I just really want to drive it home that men don't get it any easier. And I went into it too thinking like, oh, men do get it easier. They have such a chill life and they can just joke about stuff and blah, blah, blah. And you don't get the same thing with women and the blah, 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 blah. Like, it's a seductive thought, but it's not really true. So I'm gonna jump a little bit to the next point. Is that she talks about informed consent, something that I am not familiar with because I never went through it. Most gender clinics today don't require the therapist note, and they don't require the parents' permission at all. And one of my gripes with that is that when it comes to any kind of form, like, when it comes to, like, oh, we have the standard of informed consent because, oh, the kid knows, or the college student or high school student knows who they are, so of course they're perfectly capable of doing. But the thing is, when it comes to forms, I was thinking about this a couple weeks ago. The thing about forms is that when you're a teenager, especially when you're a teenager, good God, or even a kid, you don't read things. Like, how many of you people watching me have read the terms and conditions or the privacy policy of any website you're using? Did you read the one for YouTube? I don't think you did. Nobody reads it. Why are they going to read a form for this type of thing? And even when they do read it, they're probably just going to scan it really quickly. And I'm going to guess, I don't fully know, but I'm pretty sure you don't take this form home, like homework, and then read it, you know, and then go like, okay, I read it really thoroughly, now I'm going to sign it. It's most likely a situation where they're like, here, sign this form, and you're like, derp, okay, and then, you know, you've signed it, didn't even read it because, you know, we're talking about anxious kids here, so of course they're going to be like, I'm really anxious, so I'm just going to write my name on here instead of, the not anxious thing you would do is be like, hold up, I need to actually read this and see what I'm getting myself into. So I think the informed consent thing is kind of BS because of that. The teen's not going to read it. Come on. Like, let's be real here. But when they do read it, it's going to be like any words that pop out to them that they really like these are the effects of testosterone, blah, 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 blah. They're going to be like, ooh, the pros. I'm going to ignore the cons because the pros outweigh them to me. And I don't care about the risks because I'd rather be psychologically and emotionally sound right now. So whatever, anything that complements their rose-tinted glasses, they're going to go for it, of course. This is why I believe parents really do need to see it, because they're going to look at those risks and they're going to be like, oh my god, you shouldn't be doing this, oh my goodness. Why don't we wait? Why don't we wait until this point? Maybe it's a little less risky when you're like a little bit older, I don't know. Because, like, not all adults know best, but they know a little bit more, I have noticed, however, that gender clinics are starting to be a little bit better at informing trans patients of vaginal atrophy, but I'm still not seeing any information on hormonal dependence. If she ever chooses to detransition, the risk of a hysterectomy will be surgical menopause and therefore will need estrogen supplements for the rest of her life, until she's 50 maybe. Being in your early to mid-20s and already a medical patient for life sounds like a grueling feat, and this should be a warning, but I mean, maybe things are different. I haven't really been checking in lately, but I'm pretty sure it's not there. But a kid is gonna be like, medical menopause? I don't know. Whatever. So Abigail moves on to more of the actual risks of testosterone, I guess. And so she mentions Chase Ross again, and he was claiming that the risk for cardiovascular disease is on par with biological males, and I disagree. But what Abigail says is that the reality might be they don't. There's not too many studies yet, considering that it's kind of the whole trans thing is kind of new in a way, and there's no really long-term studies. But he may be at risk of 2.5 times more likely to have a heart attack than that of biological men, and then comparing that kind of to nearly 5 times the risk that natal women have. And in my opinion, in my view, women, biological women will never be on par with men biologically. Even if she has the same amount of testosterone coursing through her veins, her body was not physically built to hold that unnatural level, and so her body will react differently to it than that of a biological man. She will experience something uniquely androgynous based on female biological capacity, which kind of goes back to the bone thing, but it's also like every bit of DNA, every detail of our bodies is fundamentally sexed, and just having more testosterone doesn't replace all of that. And so when a biological female gets exposed to this very aggressive drug, I don't exactly know the ins and outs of it, but it's definitely unnatural. Like every woman, yes, every woman has a little bit of testosterone in her, but it's what she's meant to have. So making that, increasing what's already there to male levels, you're just begging to be put at risk for something else, and it's not on par with men. It's not. It's, well, according to what Abigail's trying to say, is that it's a little worse. Another issue with testosterone is that, oh boy, endocrinologists, I can say that word, rarely evaluate the progress with the patient's gender dysphoria, which is what a doctor would do with any other medical problem, to make sure everything is going well. Quote, what they examine instead are blood levels to ensure that testosterone stays within normal range for a man, unquote. for me, when it came to my doctor, I do remember him checking my blood levels, but he never like checked periodically. I don't think I was like going in every 6 months or something or whatever. I wasn't on it for multiple years. I'm sure somebody who's a detransitioner, or even maybe they are a trans man, maybe they know. Maybe they checked in every now and again with the blood levels, but in any case, it's just blood levels. It's like you can't really. What are you gonna do with their emotions? I guess it's not the same thing. But anyway, assuming that Abigail's totally correct, endocrinologists do seem more superficial, quote, who aim to satisfy more than seek to cure, unquote, the patient. According to the guidelines for the primary and gender-affirming care of transgender and gender non-binary people, that one's a hard... that does not roll off the tongue at all. Quote, the goal of masculinizing hormone therapy is the development of male secondary sex characteristics and suppression/minimization of female secondary sex characteristics, unquote. So that's to drive home the point that all that really matters is the appearances of testosterone effects of it, as opposed to, the gender dysphoria that the person might be feeling. Since we know that surgeries and cross-sex hormones don't necessitate reduction of suicidal thoughts, this is less about alleviating gender dysphoria and more about appearances. If detransitioning and desisting is ever an occurrence, the regret will lie in the permanent changes testosterone gave her. Her voice will not naturally rise to where it used to be. Exhibit A. Her facial hair will never thin back to peach fuzz. Exhibit B. I can't show it. I shaved yesterday. Her larynx will always be prominent, and I don't know. I don't know if you can see mine, but I can definitely see it. Like, I can feel it. I can feel that it's right here. And, okay, when I do that, you can kind of see it, but it's there. You could have it shaved, but I don't really want to do that. Her clitoris will always be larger than average. Here, guys, let's look. Oh. Exhibit C. No. I think it largely depends on age, but facial masculinization might not reduce to what it once was. Like, if the natal female was on testosterone for like 6 to 10 years, maybe, and then she desisted and detransitioned, she might not ever get it fully back, especially when she's like maybe 30, in her 30s or 40s. I think it really depends. I don't think we have many studies on this quite yet, but that's what I'm thinking. Like, wouldn't it make sense? Like, wouldn't your bones change a tiny bit at least? Especially when you've started, when you're like 15 or even younger, I don't know. For pains and inconveniences, says Abigail, there is vaginal atrophy, which we've mentioned before, but also muscle aches, painful cramping due to endometriosis, increased sweating, moodiness, and aggression. Long-term effects include heightened rates of diabetes, stroke, blood clots, cancer, heart disease. In general, mortality risk rises. Another major risk is if the trans-identified girl ever misses a dose, she could contract endometrial cancer, which kind of seems a little terrifying. And I'm so glad that when I was on it, I never ever missed a dose. I was always on time. So I'm very glad that I was extremely vigilant. So she moves on to top surgery, which is the double mastectomy. She introduces us to a doctor named Joanna. I guess. When I see a J, I always think it's pronounced like an H, because I studied a little bit of German. But Joanna Olson Kennedy claims that, quote, "If you want breasts at a later point in your life, you can go out and get them." She says very enthusiastically, like, it's okay. You're Even if you do regret it, you can just get them back. As if, well, wouldn't that be kind of nice to have it like preserved somehow, and then you just stitch it back on? Uh, I don't. I'm just imagining just like a breast with the skin on, and then just swing, 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 swing. There you go. Good, you're good to go now. Everything's all linked up. You're fine. But yeah, she was saying this for like damage control, pretty much. So that way it gives the impression that there is no buyer's remorse. But the thing is, breasts aren't clumps of fat as much as these very sad and poetic, uh, gender dysphoric people think it as, or they'll even call it chesticles, and it's just like, oh god, just cringe. Stop it. They're called breasts. Come on. When you say it's a clump of fat, it makes it sound like there's no real function behind it, and there's no emotion, just basically no connection to it on an emotional level. And nobody has said that in the book. I'm just saying it because I've seen it, like when I was a teenager and going through this phase. That's what I saw too, and I held that belief too. Oh, they're just clumps of fat. There's nothing special about them. But in the book, it says what's actually inside the female breasts are a, quote, a series of fibrogranular structures roughly dividing into quadrants. Within these quadrants are a number of lobules connected through ducts, which lead to the nipple, and milk ducts. And I'm probably gonna put a picture up. I don't know, and then it's just that's how it works. It's all made for milk production and arousing sensations. God damn it, for lack of a better word. Good lord. Double mastectomy comes with a risk of infection. Seroma, which is a fluid accumulating under the skin, pain, bleeding, oozing, skin flaps, and nipples that resemble cooked hamburger meat. And for me personally, I have heard that the nipples may fall off. There is certainly, especially depending on like how good the surgeon is and which type of double mastectomy you got, there could be a complete loss in sensation. When it comes to breast augmentation as a replacement for breast, it's clearly not a breast, but an appearance of one. Dr. Lampert asserts that this type of replacement is more akin to replacing one's brown eyes with a desired blue, but you gave them glass eyes. That person's eyes may now be blue, but they don't function as eyes. It's morally wrong to destroy a healthy human function in the name of plastic surgery, is what he says. It's not a direct quote, but it's the gist of what he said. When it comes to breast implants, as the book mentions with Dr. Hugh McLean's website, which reads, quote, "For us, the diagnosis is made by the patient, not the doctor, in the same way that a patient is seeking breast development is the one who diagnoses her own breasts as being too small," unquote. The function of breastfeeding is still present and will retain nipple sensitivity, whereas the double mastectomy completely removes breastfeeding potential. With breast reduction, breastfeeding may be complicated or won't function at all, but the fact of the matter is you will still retain the majority of your healthy breast tissue. These procedures have complications, and many women regret having it done, especially when they were like 19 or something, and later became mothers. Everyday people are not experts. They are prone to misdiagnosis and have a penchant for being stupid. Moving on to bottom surgery, phalloplasty, and metoidioplasty? I don't know. Yeah, I'm going to say right away, metoidioid. Metrodplasty. It's she doesn't cover it really much at all. She just kind of briefly talks about it, and I would say that metoidioid plasty is I think it's one of the less risky procedures, and I don't see why not. I don't see why a trans man wouldn't go for it, to be honest. Like, yeah, you got like maybe a 2-inch dick, but like a lot of guys have 2-inch dicks, you know? So it's kind of the same thing. And you can get at least a minor erection, because that's what the clitoris does as well. It gets, aroused, so then it's, anatomy. Abigail's main point of friction is phalloplasty, and so when she goes, I was talking with a friend of mine, and we were he made me go like, I'm gonna look this up, because he was saying it's nasty. It's gross, man. It's not for the faint of heart. And I mean, no surgery really is, but I went ahead and looked at it anyway, and I was just, good thing I was sitting down, because if I was standing up, I would have fainted. It's just, it's a Franken dick. It just looks so weird. Ugh. And even when there's like a bunch of surgeries to make it look as like realistic as possible, it's still weird looking. And you have to live with that for like the rest of your life, maybe. I mean, what are you gonna do? Like, you can't do the same thing that they do with, or maybe you can, I don't know. With trans women, where they basically just grab the tip and just shove it in. So blood clots are common with this procedure, which can cause the graft to fail, which is the skin graft. Quote, creating an open wound that, because of inflammation, cannot be sutured closed, unquote. Gangrene and loss of appendage is possible, given that the hair from the forearm could regrow. The extended urethra, I don't know, could leak internally and externally. An internal leak can produce scar tissue and strictures, quote, resulting in urine that will not stream but fan out in a spray, unquote. Many who undergo this surgery may end up without any genitalia at all and are forced to use a catheter, which is never fun for anyone. She was saying that when it comes to grafting, you need a microsurgeon to do it, and there's just not that many microsurgeons out there that are skilled. It's extremely skilled to get all the little fibers and stuff all connected together. That way you can actually feel, sensation in your Franken dick. And that's a really scary thought. And probably because there's not that many microsurgeons out there, and it costs a shit ton of money, of course somebody's going to be like, no, I can't do it. Abigail brings up a trans man, I guess, named Blake, who underwent this surgery. Blake just so happened to have one of those doctors that just aren't skilled, or they're not even a microsurgeon. So because of that, the whole entire experience was a disaster. Quote, the implanted urethra developed strictures which required additional surgery to insert a suprapubic catheter to divert the urinary stream so that the wound could heal. The suprapubic tube developed sepsis. A blood clot led to pulmonary embolism, from which he nearly died, unquote. Next quote is, he could no longer lift objects, and even a breeze was enough to send painful shocks through his arm, unquote. After such a disaster, he is understandably highly critical of the trans community that sugar-coated transitioning and all its procedures. When he confronted his therapist, who had encouraged him to transition to begin with, quote, she seemed to think that he had no reason for regret because transgender was what he's supposed to be, unquote. And I laughed at this when I read it because it's just like it's tragically hilarious, and I say that in a bitter kind of cynical way. I'm not normally cynical, but it's just like, what? Who are you? Who the hell are you to say you're meant to be trans? What she's basically implying here is that she's the one who actually knows best, right? And I thought that was like the whole thing, that like the whole thing is the patient is right. So how can you possibly say as a therapist you're meant to be trans? You don't know. That's what your policy says. You don't know anything. Your patient knows more than you. The trans community makes transitioning seem so simple and easy because when you read about how the procedure is done, it seems fairly clean and simple. But then when you actually go through with it, it's like, oh, I hate my life. It's in eternal pain. I'm bleeding. Yet the trans community doesn't tend to face this reality. I'm not saying all of them. Some of them are sensible, but others are like, it's easy. I like that a detransitioned male named Jade, I guess, points out that the Affordable Health Care Act of 2010 altered cross-sex hormones and surgeries to be free and affordable. Therefore, quote, when you hide the cost of hormones and surgeries, it makes it seem simpler and safer than it actually is, unquote, because, quote, if something is really expensive, it gives you pause to accept how important it is. But if it's free, it's just like, sure, I'll take it, unquote. This is why I didn't pursue top surgery or bottom surgery. The price tag really put a major pause on my impulsive decision making. And I know that that's not going to stop everyone. But it's kind of besides the point. The motif of sugarcoating goes beyond the trans community. It extends to WPAIF. Conferences, which exclusively have showcased the benefits of medical intervention for trans people. All discussion of risks are greatly discouraged and kind of just taboo, like you shouldn't be saying these things. I found it silly and ridiculous that when Abigail reached out to Dr. Olson Kennedy to get more context of the sugarcoating business, she never responded. And, you know, when you run away from something, when you're running away, it just looks a little suspicious. So, that's the end of this chapter. I'm going to skip conclusions from now on because I don't think they really add anything. It's just kind of repeating some of the stuff, but in a different phrasing. So, that's all for this video. I hope to be back next week, but apparently you never know. And especially with the holidays, it's going to be a little, you know, up and down. I'm not entirely sure, but we'll see. Anyway, so I'll see you when I see you, I guess. Goodbye.